So we based our clinical functional test on the respiratory noise, okay? So the noise these dogs were making. This is stertor. I need to kind of cut that one a bit. So that's an awake snorer, okay? And that's typically palate or nasopharynx, okay? So nasal, nasopharynx, palate will create that kind of noise. This is stridor. This is larynx, okay? So that's larynx. If you hear that in a brachycephalic dog, it's larynx. Then this is also stertor, but it's nasal stertor. So it's low-pitched again. I can cut that one. So the respiratory functional grading system is pretty straightforward, really. So what we do is we listen to these dogs, we listen to the chest, and then we listen to the side of the neck in a neutral position. And then we do a 3-minute exercise test. Now, this is not a tolerance test. This is just a way of increasing your airway requirement. So we're trying to increase your oxygen demand and just see what happens, okay? And then we will grade the dogs on the highest noise that they have either before or after the test. The equipment you need for this is a stethoscope. Why do we include the exercise test? Because it makes it easier for us to diagnose BOAS. And we saw lots of dogs, often bulldogs, often pugs, that they were quite relaxed with their owners, and they had a nice low respiratory rate, but as soon as they did anything, then they had obvious airway disease, okay? So this is a 1-year-old bulldog. It's a little bit of nasal noise, but nothing too exciting. It's nostril. This is after 3 minutes, just 3 minutes. This is the same dog when it's recovered and it's nice and quiet in the consult room, okay? Now, when we started out, we were told that we were making the disease. We're not making the disease. Most dogs should be able to exercise for 3 minutes without showing that kind of obstruction, okay? So, and I think the breeders now, having seen so many good dogs go through, understand this. Now, we looked at different kinds of exercise, and for us, we are far more sensitive, 40% more sensitive, diagnosing BOAS if we use a trot test than if we don't use a test, okay? So consult room versus exercise test, 40% more sensitive. We are more sensitive on a trot test than we are on a walk test. So if we walk the dogs, that's the left graph here, okay, we're more likely to diagnose them with BOAS if we trot them, okay? And it's a 3-minute trot, so it's pretty swift to do, and you can do the whole assessment in about 15, 20 minutes. Now, another question we had is stridor laryngeal? And the reason we had to answer this, I'm so sorry, guys, you're going to have stridor absolutely solid soon. The reason we had to answer this was because it wasn't in the literature, okay? So for years I've been teaching my students that stridor is laryngeal, not in the literature, so we checked it, and it is laryngeal, okay? So if you hear stridor in a pug, in a French bulldog or a bulldog, then it is laryngeal, okay? Now, the only thing I would say is you have to be a little bit careful because it's not 100% specific. So you get occasional dogs that will have laryngeal disease with no stridor, but if you hear that stridor, the dog has got laryngeal disease, okay? And then the French bulldog and the bulldog particularly, that's really significant because that tells you you've got severe airway disease. So this is how we devise the grading system. So the grade 0 dogs have got no airway noise at all when you listen to them with a stethoscope before or after exercise. They are completely as any other dog, okay? So nothing, right? The grade 1 dogs have got mild noise, so you can hear it with a stethoscope before or after exercise. Now, we have been repeatedly challenged about this because, you know, the grade 1 dogs have got some noise. Yes, they have, but they have minimal clinical signs, okay? So these grade 1 dogs can exercise, they can sleep, they can eat, okay? So I am actually pretty happy to say grade 1 dogs are pretty much unaffected, okay? So the grade 1 dogs for me, if we get all our dogs to grade 1, we'll be doing really well. Now, the grade 2 dogs have got noise that you can hear without a stethoscope, okay? It's really straightforward. If they are breathing and you can hear that breathing without a stethoscope, they have got moderate BOAS in our scheme. And the grade 3 dogs have got severe BOAS, and they have got obvious signs of dyspnea. Now, dyspnea is a difficult term. It's a human term that has suffering in it, which is tricky. So we have explained dyspnea in our grading scheme as dogs that can only concentrate on breathing after exercise. So these dogs will not socially interact. They are not going to do anything else. They are just heaving and breathing. And we have licensed this scheme with the Kennel Club and the University of Cambridge, and we launched it in 2019. Now, we did put some breeding guidelines with it for the UK, and what we have said is about 15% of our dogs are grade 3, and these are our show dogs, okay? This was the old data, so this is 2010 to 16. So we think it's reasonable not to breed the grade 3 dogs because there is a welfare issue for that individual dog as well as a risk to the progeny, okay? So the grade 3 dogs should not be bred with. Now, the grade 2 dogs are still about 30% of our dogs. If we take those out completely, in the UK, we will drop the population too quickly, okay? So the grade 2 dogs, we are saying you can breed them, but please be careful and breed them to grade 0 and grade 1 dogs, okay? And the grade 0 and grade 1s, go ahead. So this is relatively early in the scheme, and then we had a little bit of a problem with this thing called COVID. But these are the numbers that are coming through. Now, I think you can see that the breeders are prioritizing their good dogs, okay? So this does not mean that the bulldogs have suddenly become increasingly healthy in the UK. What it means is the breeders know which dogs are affected. Well, that's half your battle, okay? So if you go to the dog shows now, you do not hear affected dogs, particularly in the bulldogs. At Crufts this year, I heard 1 out of 40 bulldogs where I got audible breathing. That's remarkable. 15 years ago, you could hear their breathing before you opened the doors, okay? So the breeders understand this system as well as I do now, and they are prioritizing the dogs that are good. Does that matter? As long as they're breeding from those dogs, it doesn't matter. And most breeders, as I think you guys will agree, they don't want to breed diseased dogs. They are looking to breed healthy dogs. So if they understand the system and they are prioritizing their healthy dogs, I think we're doing okay. Now, these are some of our... Panting is fine. Panting is allowed, okay? Every dog pants, okay? I have to put that up because everyone goes, oh, it's making... No, it's panting. This lady here is 11 years old, okay? I've been following her for a few years, 11 years old. Okay, I like that. These are our grade 0 pugs coming through. Same dog after exercise, okay? We are seeing these dogs, okay? These dogs are definitely out there. This is our grade 3 pug. Just going to move on. Grade 2 French bulldogs.